Good morning, everybody. My name's Marcy Albu. I'm the Chief Executive of the UK PHR. It's my very great pleasure to welcome you here this morning. There's about 75 of you, I think, on this conference call. It's absolutely fantastic that you're all patching in. I hope it's a really productive morning for you. For those of you who were here last week, I think most of you, it was a really, really interesting session. I certainly valued it a lot, and I'm really, really grateful to Andrew, our chair, for hosting that. Hopefully I'll do as good a job today. We've got a great day ahead as well. We've got a session from Maggie Ray later on, which I'm sure we're all going to be looking forward to, as well as some workshops and opportunities for you to talk to lots of other people who are working in the public health space. So including something about fake news, which I'll be very interested to hear about as well. So I hope that we have a really productive morning, an interesting one, and that it's a good use of your time. I'm very, very grateful to you for turning up. I just want to introduce, first of all, Tim Andrew, who's going to be speaking to you first. And after each of the speakers, there'll be, of course, opportunities for questions. There's a chat, obviously, as in all of these online events. So please feel free to make comments as we go through. Tim is the organisational lead for strategy and change at Public Health Scotland. He helped establish Public Health Scotland as part of Scotland's public health reform, and for those of us living in England, that's really interesting as we go through changes here too. He started his career at the UN Food and Agricultural Organisations on their avian flu task force. He's also had roles in race equality, mental health improvement, and worked in the Scottish Government. So a vast array of experience. I'm really delighted that he's here to talk to us today to talk about public health planning in Scotland. So welcome, Tim. I look forward to hearing what you've got to say, and I'll hand over the floor to you.
Thank you very much, Marcel. We've had our IT glitch for this morning, so I hope it's seamless from now on. I'm going to try and share my screen with you so you can see my presentation. Give me 1 second. It's a real pleasure to be with you today. I am going to give you a quick overview of public health planning in Scotland. So in the next 10 minutes, if you know nothing about how public health planning works in Scotland, you should know enough to be able to fake it in a conversation. I'm conscious so that some of you will know a lot about how public health planning works in Scotland already. And so, I hope that we've got enough to start a good conversation at the end of this. When I've finished speaking in about 10 minutes time, you'll be able to describe my sense of the strengths of public health planning in Scotland and where we can strengthen it in the future. And as Marcel mentioned, there's an opportunity to ask me questions, to start a discussion. I know some of you in the room know a lot more about public health planning in Scotland than I do, and it'd be great to have a conversation about that, and also how it can, what we can learn from the other parts of the UK and what other parts of the UK can learn from Scotland. So this definition will be familiar to many of you. It's I think the Aitchison definition of public health, and I think it's really like the starting point for me around public health planning. It's this: public health is the art and the science of preventing disease, prolonging life, and promoting health through the organised efforts of society. Organising the efforts of society is planning is a big part of that, and planning in public health has elements of both science and art, and you need to be good at both if you're going to make it work. And so as in public health, we think about Public Health Scotland, we think about planning. This is something that we keep coming back to. So a rapid overview of planning for public health in Scotland. The document you can see on the left of your screen is the Christie Commission. Just about 10 years ago, the Scottish Government asked for a review of how to renew Scotland's public services, and that became known as the Christie Commission. And it said three really important things that we keep coming back to in Scotland around how public services should work. It said we need to plan for outcomes, so not working to objectives for organisational convenience. And it said we need to collaborate better across the public services, and also that we need to reform our public services so that we get more value for our money. The middle one is the National Performance Framework. So all public bodies in Scotland should work to this. It's a set of outcomes underpinned by indicators that describe where we want to get to as a country. It covers all sorts of aspects of life, from public services to the economy, and for us in Public Health Scotland, predominantly health. The outcomes that you can see here, you probably can't read them on the screen, but this they're pretty big and high level, but they're underpinned by a series of more detailed indicators. And for us in Public Health Scotland, the really primary one there is about improving healthy life expectancy and reducing premature mortality. And so while it's got big general ones like that, it also drills down in more detail. So for mental well-being, it uses the Warwick Edinburgh Mental Wellbeing Scale. And these are measured on a regular basis, and public bodies in Scotland, local and national, public health, economic development, service delivery, all should line up against these. And this is meant to be about how we fulfill that thing about planning for outcomes. About 5 years ago now, the Scottish Government and COSLA, the Convention for Local Authorities, started a process of public health reform in Scotland. And that did another three things. That was about creating shared public health priorities for Scotland, establishing Public Health Scotland, and getting the whole public health system to work better together than it was at the moment. And so between the National Performance Framework and the public health priorities, that's really the starting point for all public health planning in Scotland. That's a really rapid overview. The thing I should add is that in Scotland, public health is organised. There's a national organisation, ourselves in Public Health Scotland, and then there are, in each area, there's a director for public health. Unlike other parts of the UK, the directors of public health are based in NHS boards and accountable through NHS structures. But we work closely with our colleagues in local government as well. So this is my sense of the strengths and where we can strengthen public health planning in Scotland for the future. One of our strengths is, I think, that whole system emphasis. And you can see that right back in public health reform and trace it right through to the Christie Commission. We saw that strength come to the fore, I think, in contact tracing as part of the COVID-19 pandemic. The starting point there was that we need to come up with a system that augments and supports local areas to do what they can best do in terms of contact tracing, but that joins the whole country together. And while it's not been perfect, I think it was a really strong starting point. There's a commitment to outcomes and population health. There's no dispute about that in Scotland. And also there's a real recognition about the importance of collaboration. One of my roles in setting up Public Health Scotland was to look at what values the organisation should have. And one of the resounding ones that came out from both stakeholders and staff was we want to be a collaborative organisation. And that's our first value. This is my final slide, and then we'll open up to questions and discussion. So I think there are some areas that we can strengthen in public health planning in Scotland. In the last 10 years or so, we've become really adept at using logic models to demonstrate our links to outcomes. And that's great, and we should keep that. I think the way we should build on it is by strengthening our ability and our skills around managing stakeholder relationships. You know, it's good, but it could be more consistently good. In the other areas to strengthen around local and national, more mutual appreciation. I think a lot of works well at the moment, but it could work better more consistently. We look to other reformed public services like Police Scotland, where they brought lots of police forces into one single police force, and they have a much more seamless approach to planning that transcends the local national boundary than we currently do in Public Health Scotland, and that's something I would like to see us get better at in the future. And the third one sort of lies behind that. Sometimes our planning approaches, I think, don't drive collaboration as well as they could. So, for example, this year I have been working on Public Health Scotland's plan for the next year, and who I'm thinking about in that mostly is I'm thinking about how do I deliver for my sponsors in the government and my board. And my colleagues who are planning in local areas are probably thinking the same thing. But I think there's something there that we could do to help us to create systems that help us plan better together than we have in the past. It's not all bad, but I think it's something that we could strengthen. So that's all I wanted to do. I hope that has given you a sense of how public health planning works in Scotland. For those of you who know public health in Scotland very well, I'm sorry if you find that frustratingly lacking in depth, but I think for those of you who don't, I hope you don't have the sense that I sometimes get watching Line of Duty late at night with my wife, which is trying desperately to stay awake, while also make sense of a lot of acronyms and try and keep a handle on what's going on. So I'll pause at that point. Thank you very much for your time and attention, and I'm really open to discussion and questions.
Thanks so much, Tim. That was a really, really helpful overview of what's happening in Scotland. I was interested in that point about the analogy with the police. I was working in the Home Office before, or when the proposal to create Police Scotland was being mooted, and there was, of course, a lot of opposition amongst the existing police forces at the time. But obviously, that's happened, and you're using that as an example of better collaboration. So apart from merging everybody into one authority, how in practice has a good collaboration been demonstrated in Scotland between the national government and the local authorities there?
Are you meaning in relation to public health or in policing?
In relation to public health, yeah, definitely in
relation to public health, yeah. So I think I mentioned contact tracing as a good example, and I think in different areas you see different strengths in terms of collaboration. So we know that some of our, in terms of health protection, we see good collaboration with particularly some of the rural and island boards, where having a national resource is really vital to augment their services. I think what I see that is a bit different, that has developed in police and fire in particular, isn't so much the institutional change. It's more like an attitudinal one. They feel further on in their appreciation of the complementarity of local and national. So sometimes I hear in health a frustration from my local colleagues that people in the central belt, like me, based in Glasgow, we just don't get what's going on with them. And then on the other hand, I hear colleagues who work nationally be frustrated that local colleagues only see it from their own point of view. What I have seen in police and fire is that each side appreciates that the other brings a perspective that they don't have. So I don't have the perspective of what's going on in a local area. I need my local colleagues to bring that. And equally, I have something to offer them. So I think maybe more than an institutional fix is an attitudinal one.
Yes, I mean, I completely agree with that. We've got some questions about this issue. One from David, which essentially I've just asked. One from Jacqueline, which is how can we get mutual outcomes for public health and local authorities, because often they can be at odds, which is indeed what you've just been saying.
Yeah. So I think if there was a totally easy answer on this, someone would have thought of it before me. I think the public health priorities are a really good start on the way to those. There's a couple of ways in which they're certainly in Scotland unique. They are jointly owned both by the Scottish Government, so the national government, the Scottish ministers, and the Convention of Local Authorities in Scotland. So they are a really strong starting point where local the umbrella body for local organisations and the national government have said these are the big priorities for public health in Scotland. And so I think that's a good starting point. The next step in the conversation, I think, is for us together to have a conversation about, so how do we actually turn those into operational plans?
Yes, and just building on that, Melissa asks about these priorities, about whether you think it's right for us to plan for all priorities to be achieved, or whether it would be better to focus on a few at a time.
Yeah, I mean, that's one of these eternal tensions in public health, isn't it? Because, there's so much you can do. And you've got that thing, do you dilute your resources? Do you focus it and risk ignoring some other things? I think the truth is it's a bit of a balance. There are 6 public health priorities, and they don't cover everything, but they do cover a lot. And so my sense is, that when we look at our resource, they should predominantly be going towards those public health priorities. Yeah.
Okay, and if there's disagreement between different actors like local authorities or government about which should be focused on first, how is that resolved?
So in relation to the public health priorities, I don't know if we've seen that work through yet. And so it's a bit of an unknown. I suppose that the challenge that we've had is the public health priorities were a year old, and Public Health Scotland was no days old when COVID happened. And COVID wasn't one of our public health priorities, and yet it's clearly the #1 priority in public health worldwide, and certainly in Scotland. And so we've not worked that out yet. And one of the things, though, that we're thinking about is coming out of COVID, do we need to refresh those priorities? Take another look and check that they're still right. I mean, my sense is that they are predominantly right, but we maybe need to, the angle that we take on some of them might have changed. And I think we need to just keep going back to that ethos that we started with at the start of reform, which is this needs to be a collaboration between both local and national governments, and both have democratic legitimacy.
Absolutely. And so taking a slightly different angle on this issue of collaboration, you mentioned you're in the Central Belt. We've had a comment or question from Elizabeth, who works for NHS Highland, who is asking about the way in which you can ensure engagement with rural population health and making sure that that's met, as well as those who live in more urban areas.
Yeah. So I think there's a variety of answers to that. One sort of way of building it, we have built it into the organisation, is in our board. So uniquely among health boards in Scotland, so we're constituted as a health board, and uniquely among health boards, we have local councillors appointed to our board via COSLA. And one of the ways I see that question be prompted by us is through our board members. We have a former chief executive of Highland Council on our board, and he keeps us accountable for making sure that we are, when we talk about poverty, that we're remembering that poverty in rural areas and urban areas looks very different. So that's one level. There are duties in Scotland to look at the impact on island communities. And I think one of the things that our legacy of organisations did that I would like us to continue is, when we're assessing the impact of our work, not just restricting that to protected characteristics, socioeconomic and island, which are the things we're obliged to in law, but also looking at things like rurality. Scotland is a diverse country, even though we're quite small, and so we need to be keeping that at the forefront of our mind.
And very beautiful country. I think you need to emphasise that
Yep.
for all of the time that when we can travel, we can all go and visit you in Scotland, which will be absolutely fantastic. Another point that's come in from Sue is also on this theme of engaging local communities, because she makes the point that during COVID, local communities, local people helping out made a huge difference to public health outcomes, and what can be done to ensure that that happens across the country?
Yeah, so I don't have a neat answer to this one either, although it's something we're thinking about. I think from our perspective in Public Health Scotland, we really see the value of public and community engagement, but it's, I think, easy for us to do badly, and we've not quite worked out how we're going to do it well. But I think the answer lies in close collaboration with our local authority colleagues. The thing that mistakes that national bodies have made in the past is to parachute into a community and to talk about what they want to talk about, and I don't think that's really in the spirit of listening to communities. I think it starts with, what are the issues for the community, and then the public bodies need to line up against that. And so we don't have an answer to exactly how in Public Health Scotland we're going to be doing that, but it is something we're thinking hard about, and we have on our list of things we're trying to work out. We've been having conversations with, if anyone has examples of good practice, people who've done it really well, we are very, very interested in those. Pinch with pride is one of our mottos. Well, one of mine.
Absolutely. I think, well, that has to be a motto for all of us in the public sector. We're all trying to achieve the same goal in different places, maybe different organisations, but it's all really important for us to work together. So just building on that, bearing in mind that we've got people on this call from all 4 nations of the United Kingdom, what do you think would be helpful for us all to do to make sure that whether we're working in Scotland or Wales, Northern Ireland or England, that we're working collaboratively together to secure outcomes that of course cross our national borders?
Yeah, so I think one of the strengths that public health has is we've got that sort of international perspective. My father-in-law used to work in logistics, and his particular bit of logistics used to talk about, we're above politics and beyond history. And I think there's something like that in public health, and we need to keep on that ethos that the 4 nations are vital, and I think that's well appreciated in health security, that we work together, and we're part of an international community too. I think the keeping the professional links like this, the UK Public Health Register, but there are other ways too, are a vital part of that. Just speaking to colleagues in other countries and hearing what's going well, and I think also remaining active participants in Europe, because institutional changes haven't changed geography.
Yes, absolutely. And regardless of the politics, obviously, those are to make a difference on the ground in whatever roles we've got. We need to be looking to make sure that we've got those links together to make sure that happens. And I hope very much that that all the people on the call, as well as the UK's Public Health Register, which is obviously a UK-wide organisation, we can work effectively together to make sure that the whole public health system is supported and does the job effectively, regardless of all of these other changes that are going on around us. I've got a specific question from Simon about whether PHS can support ending destitution together, the strategy from COSLA, and any lessons for England about people with no recourse to public funds. So I'll just leave that specific question with you to see if you want to answer that one.
Yeah, I think I will struggle to field an intelligent answer on the second part of it. I don't know enough. I think the thing that we in Public Health Scotland have started well with is that parity of esteem between our sponsors. So we speak each week to both our local authority and national government sponsors, and that is helping us make sure that, so for national bodies, I think the tendency is to focus on national government, and that's certainly been our tendency in the past. And so when it comes to areas like that, our COSLA colleagues have a route in to say right away, Public Health Scotland, you're not pulling your weight in relation to this area. They've not said it in that one, but I think there is something about, baking in to how you work that regular communication.
Thanks so much, Tim. A last question then, which comes from Fatima, which is a really nice one to end on, which is about how you and we all together get buy-in for a whole system emphasis when we're thinking about public health, because we all know that that this is not about an individual intervention in a particular place, but it's about the whole of the population's health. So how do we get buy-in for that? I mean, any tips that you can give or any examples?
So I think the thing is always to keep our eyes on the prize, isn't it? So in Scotland, that's defined as healthy life expectancy and premature mortality. And I think if you go to other nations, what is the outcome we're trying to achieve isn't going to be too very different from that. And at the end of the day, for all our institutional differences, as people working in public health, that's what we're there for. I work alongside a lot of colleagues in corporate services and accountants and HR specialists, and when they're talking about why they work in with or for Public Health Scotland, that's what they say. They say, well, I love your mission. I'm here because of that mission. And as public health people, that's why we're here too, isn't it? We're not here to represent our own little fiefdoms. And so for me, when we're trying to collaborate, it's that focus on the outcome. And the rest of it is sort of mess for us to tidy up. But that is the thing that we share at the heart of it, a vision for Scotland, for the UK, for people around the world living longer, healthier lives.
Absolutely fantastic. Well, goodness, Tim, that's a fantastic note to end on. I'm incredibly grateful to you for your time this morning and for the thoughts that you've offered. I hope very, very much that that this can act as a stimulus for people to look beyond their fiefdoms, as you say, at what others, colleagues are doing around the country, indeed around the world, including in Scotland. I really, really wish you well. And let's all virtually give you a round of applause.
Thank you very much.
I'm sorry that we can't, you can't have a whole auditorium clapping at the moment, but you can imagine it.
I will do. Thank you. And thank you for the questions. If they were too hard, I was going to have to fake some broadband problems.
Brilliant. Thanks again, Tim.
Thank you very much.
I'm really grateful for your time.
Cheers.